are some damn fine signs.
And then, there's nothing on the back of this, but.
Yeah, I don't think one West
Form
has
you
any
that-
rules about sticks, but some places don't allow.
Did it, most of it.
Oh, good. Free our people
That is
like
all
that.
right.
Yeah, and guess what? I've got the cutout that we can use to like spray paint if you want to.
Awesome.
I don't, or should I put it back in the car?
We just field tested them a bit.
I got it at the dollar store. Okay, I don't have it.
Okay, can we cut through here? Yeah.
Joe?
I got it.
You got it?
Yep.
All right, tell them we're ready. We got a lot of stragglers.
We just got it all on the internet, the data from all the open meetings that we had in the town hall. Just went up on the site, so you haven't missed a thing.
Yeah, but we have,
Well, actually, even though all those went up, there's still
Right.
a freeze happening right now, and we're still in a crisis where your office now has full control over what happens with Medicaid dollars, so.
Well, we have to get the budget signed. Nothing can happen until we get the budget.
We know the budget's.
Right, but we have not been able to make any changes until we have the authority to do it. And the authority was first in Act 10, which got tied up, now it's in the budget. So until it's signed, we don't have the authority to make changes, which is why the freeze doesn't go into effect until date certain.
however, what kind of discussion's gone on? Because when we met with you and Dennis Smith, we were told that we would have a lift on community, the freeze on community-based services, that we would be able to be part of the process and
And you will.
but months have gone by now. That was in February, now it's March, April, June, 3 months. And we're hearing all this news about the budget repair bill, about the budget,
That was-
biennial budget. And we feel like we
in,
have really been
right.
misled.
Hey, how are
Right.
You have not, because we have not had any of those change meetings yet, because we can't.
Yeah, but what are we gonna do? Wait until those changes are made and then it's too late?
Wait until people have to go into nursing homes before they
No,
can
as
get
we
access to
said,
community
everything will be
services?
online, as we put together plans, everything will be online, everything will be brought out. And we've been putting stuff online as we've gathered it, and we haven't moved it forward at all because we haven't had the authority to do it.
But you know, the news that we're getting all the time, every day about the budget repair bill, Dennis, is bad news. And we don't see the demands and the things that we talked about when we met with you being addressed at all. I mean, we see it going in the opposite direction.
Well, what we're trying to do, I'm sorry to barge in,
No,
but,
So are we.
It's good.
it's good to see.
He didn't really mean that.
You know, I mean, fundamentally, what we want to do, what we intend to do, and what we expect to do, whatever we do is gonna be better for you as the individual who's relying on our programs. You've heard me always talk about Medicaid keeping pace with the people it serves. And we are going to do that. And I think that fundamentally, as I've said before, poor quality of care is the most expensive kind. We want to help people to stay in their own homes and in their communities. That's what's going to be best for you. It's going to be your choices and what's going to be save money.
So how are you going to be doing this? That's what we'd like to know, and
In
when
terms
is
of
it
the
gonna
process and when, again, we sort of took these things a step at a time. We've done a lot of outreach, as you know. We've had so much input, we just now were able to get things sort of categorized and put online. We're gonna come back to different groups and we'll look at, I don't know exactly if we'll put it in program buckets, family care, well, we're not doing anything on senior care now, but family care, Badger care, or whether we do it by populations. Haven't decided on which way we approach it, but we're gonna get back out and start rolling out some ideas and get people's reaction to them.
So,
Would you be willing to make a statement to the effect that people will have a choice between institutions and community-based services?
Absolutely.
Would you be willing to write that?
I'm gonna be writing a whole lot of things, but
No,
that
I mean,
will be
would you be
fundamental
willing
the
to
problem.
write that up?
Absolutely.
Put it on a piece of paper that we take with us today?
Well, I think it would be better if we put this out in a organized, orderly manner, but choices, absolutely.
Because we made the commitment to expand self-directed by at least 3 times what it is now.
Yes, that's part
that's
of
part of one of our demands,
That's
that
part
you guys
of what
made that
we were
demand,
talking about.
and we want you guys to have accountability for that despite what joint finance decides to do with the budget.
Well,
We understand you guys can't do it with budget constraints, but you guys did say you were gonna do that,
And
and we want to
absolutely.
see it happen.
But we have to make sure that the program is built to handle it, and currently Iris is not. And so we need to get
Well,
that
we know,
shored
I
up.
know Peter Trotman real good, and they've done a lot of gearing up, and all of a sudden
We're
they're
getting
sitting
there.
there, and,
We wanna make sure
So-
it's sustainable and it's done right,
okay.
so that it doesn't implode when
Okay.
it gets going.
So that we don't have to go through all this again, can we set a date or something when this get together, go over a press release or whatever, however
you know,
we're going?
if you all wanna do quarterly meetings, I'd be happy to do that.
Well,
And
right
talk
now,
about where
like
we're at.
we wanna know that our efforts weren't wasted today, and we wanna give the public some hope.
Well, your efforts are never wasted, and, you know, when I first got here, I reached out to you all, and I think ADAPT is, you know, you're an important part of the public input. You represent important constituencies to us, and we wanna continue to work.
But, you know, we're worried because what of
I know there's
the governor's, actions, you know, together with the legislature on these issues
I
that
know.
deal with our lives,
Sure.
you know, we're putting our lives on the line.
I'm-
It's very disturbing and it's really of great, huge concern to us because we see
I was
things
in a
going in
nursing
the
home,
opposite
And
direction.
these nursing home regulations, this lack of regulations, I find very scary. I was in one when they were regulated. And
Let's look back though, the budget does for the first time in 10 years put real money into medical assistance. Every 2 years, we come back out saying, oh, we don't have the money, we're gonna have to change all this. One of the commitments that we've made, and we've talked about this for years, is building the sustainability so that we don't go through this every 2 years. And this is the first time that there is real money being put into these programs.
But then money is being taken out too.
But,
I mean, what is it, 500
Okay.
some thousand, and then 500 is gonna be taken out. So that leaves us with really not much of any kind of money.
again, the way budget baselines work is you are projecting the cost of the program over a 2-year period of time, right? So the entire shortfall was 1.8 billion. That's what we got left from the previous administration. You know, talking about wanting people to put out statements, I mean, would you all put out a statement commending the governor for putting 1.2 billion into Medicaid?
If it
Because
meant that
that's-
people could
because
stay
that's
out of
what he
nursing
did.
homes, yeah, but currently, the way the law is written, in order for
No.
people to get community services, they have to go into a nursing home for
No.
90 days.
No.
That
That's-
requirement's right there in the budget.
No,
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 that's not what
that's
the,
not correct.
that's not what the budget says, and that's not how the program works. We're not gonna require people to go into a nursing home to get out. That has not been proposed by anyone in the administration.
What you might have
What
said
about-
is
what
the
about
definition
so-
of
so
federal
the
law
balance.
says you can
The
go.
balance, and how
The-
much is the balance, Dennis?
So the 500 million, which is now down to 460 or something like that we have to find still in savings over
Right.
2 years.
Right.
As I said, the way you go about it in what's best for the individual in getting them in the setting that they want to be in the long run, that is what saves money. So the reforms that we're gonna be bringing is not about cutting benefits, not about just across the board provider cuts, because then that becomes an access issue as well. What we want to do is give people more choices and bring reforms to the service delivery system itself.
But how are we gonna do that on that tiny shoestring amount of budget that we're talking about that's left over?
Well,
How's that gonna be
Part
done?
of this work, we need to figure out how much is saved by community-based services. You see, that's part of what the problem is, Dennis. If we got together a little more often and we knew what the thinking was on the budget,
right.
you know.
And
this-
again,
So
the
maybe
budget has now just been
a
passed.
month from now, we get together
Sure.
again.
Yeah.
If the programs are capped, how are you gonna let more people on to someone in their community die?
The freeze,
Yeah.
yeah.
The freeze? Well, again, I think,
Like,
The cap.
if
Somebody's
the
gonna die.
Somebody's gonna die, yeah.
yeah.
well, we are putting our approach together for handling emergency situations. We're putting a plan together, again, to make this in an orderly fashion. In discussions that we've had with folks, even under a cap, people go on and then people will come back on. It's not a cap that reduces the number of people. We always stay at the number of people that are served today. So somebody goes off and then somebody will come back on.
So how do you grow a program by 300% if you're capping the program at the enrollment now?
Well,
Which is what you just said.
we were talking about the number of people who self-direct, which is within the family care program itself. Self-direction also includes the county KIP and COP programs, the waiver programs. So we can still do those things within the caps.
If
We need
people
to
are
also-
self-directing, we'll lose some of that bureaucratic overhead.
Yes.
Well,
Family care.
part of the
Well,
bureaucratic overhead that we know
We're
is
looking at
part of
that
the
in
problem
family
and
care.
has to be fixed.
But we also need to start working, as you know, the ADRCs were always viewed that they worked for family care, which is not what they are supposed to be. They're supposed, so we have expanded those. In this budget, we are increasing the number of ADRCs. We also need to train them that you don't just work for the next 4, you counsel the whole list. What are you waiting for? What do you need? Can we accomplish a great portion of this with the card benefits that are available? What are you actually waiting for? Let's make most of this happen. So instead of just talking to the next 4 or 5, we need to be looking more systemic.
Right.
And that, I
There's-
think, will solve a lot of people's issues.
20% of people on the list.
Right.
So again, Kitty made a great reminder. Personal care is a card service. There's no freeze on personal care. So, I mean,
But finding providers for the current rates are.
well, we've been talking to lots of folks about
How to do that
how to
differently.
do that as well.
And, you know,
What have you found out?
Well, I keep calling it sort of the coalition of the willing, you know, sort of, we've thrown some ideas out there and who wants to come along and join the effort.
Do you have takers?
Well, I don't wanna name specific ones, but in different groups, you know, again.
on the topic, it depends. A lot, you know, as I've told people forever, as long as we keep talking rates, we're gonna keep going over and over and over.
Right, we need to
We've gotta
change
look at how we do this differently. And so what are the benchmarks we can look at? How do we actually make this do different? We look at family care, and one of the things that came out, as you know, the audit said it couldn't answer the biggest questions that we needed to know about family care. Cost effectiveness and sustainability, but said you still have to answer those. But one of the things it did show is how much we pay per month per member for care coordination. Does that
Yeah.
seem right? And so when we look at where the money is, then we need to look at where is it being distributed. And we really need to take some serious looks in family care and say, is this the maximum use of the dollars in the system? $325 a month per member, per month for care management seems to be odd. So let's take a serious look at the distribution, maximizing that the majority of the dollars are supposed to go for direct care. Let's get there. And
Okay.
that's gonna take a little time.
Understandable, but going back to the paper that Steve asked for, would you guys be able to put out a paper to that effect, saying that that's your reasoning, and that card services and things, aside from the long-term care programs, won't be frozen and people do still have access to services? 'Cause I think that's a big concern, is that people are very concerned that when you say long-term care freeze, that means all long-term care, and they're gonna have no services in the community.
You all can help fix that by saying that's not what it says.
Okay, how about I write up something, we'll put out a joint press release?
that's right.
Draft something up, we'll take a look.
Okay, does that work for everybody?
I think
Yeah.
I think it
That's
helps
one
a lot
step.
to help,
Definitely, it's going to.
well, we wanna
Gotta
reassure
be
people,
careful, I don't
you know.
want, we don't wanna be viewed as sellouts, but
No.
we do wanna expedite things. I mean, I don't live to spend my nights on computers doing this stuff. I'd much rather.
If you help get
I'd
to a-
much rather had a glass of wine last night than sit
If we
sit in
help
the
get to a
computer.
better way of doing this, it's not selling out. It's
Oh,
doing the right
it's-
thing.
We share the same,
Yes,
we share the same goal. We want people in their homes, in their communities, the services they need to live the lives that they want,
okay.
okay?
Having said that, that sounds like a good sentence to wrap up on.
Well, wasn't one of the things that you guys discussed at the last meeting is that there was gonna be a committee?
Well, we're
We're
going
having
to,
work
we
groups.
are going to have work groups and stuff.
And you haven't missed a meeting.
Well,
And-
yeah, I mean, if you're trying to figure it out, wouldn't you want to
Yeah.
have a meeting?
Well, as soon as we have the authority to get going on it, we can't do it till we're legally allowed to do it. Which puts it at probably about July 1st. As I said in the newspaper, I think yesterday, it's a long summer of a lot of hard work.
Again, remember, there was a court case, an injunction, and we have to be very careful about,
Thinking about.
Well, every time we meet with somebody, we think about what they've told us, how we can use that, what can we do to accommodate what we've heard. And believe me, we have had mountains of it.
People are scared.
understood?
Because they don't know what you're gonna come out with.
Well, we'll put something out today.
Right.
We'll be expecting to get together about July 1st or something shortly thereafter.
July-ish.
July-ish?
Yeah.
Okay, and we need ish as in
As in within July.
Yeah.
Okay,
Okay,
alright.
Good.
Is everyone agreeable with that?
Wow, we can see if it works.
good.
It will. And see if we can do it together.
That's
Because
the best way to do it.
is the voice of everybody here and everybody in the state. That, because this is what this is about. And having representation, even on your committees, of the people that, whom this will all affect. Is just sit down at the table and let's think about, wait a minute, maybe you guys haven't thought about this. Because it's the people that really know how it feels and what it is they need and what works best for them. And, you know, you can have all the corporations and all the organizations and agencies.
That's the other thing
But
that scares us.
that's the thing,
Yeah.
there has to be the voice of the individual that this is being, what it's for. So, you know, how can that happen? I mean, other than, well, yes, you have the public hearings, you have the meetings, that's great, but what about an invitation to the actual committee? Something like that, as a representative of the people that are working, we have plenty of people in this room.
We don't have a committee,
Or just.
but we have agreed that, as we said in the beginning,
Right?
you'll be there, we're in this together. Change is always frightening, especially in this department, because everybody's afraid you're gonna end up with less than you had before, and we get that. And as I have always said, and you've heard it before, if we do it to you, it will always be wrong. But if we do it together, we can get it to a better way. And so that's what we're here for, and that's what we're trying to do.
Great. That's
In
really important.
July-ish.
July-ish.
Thank you very much
Okay.
for your time.
Thank you so
Good to see you all. Good to see you.
Where are you going next?
This was just the first visit.
Well, thanks for dropping
He
in.
said it's gonna be a long.
Is there anything, is there something we can take away today?
No, we're gonna hear, we're drafting up a joint press release.
Okay, and we'll get that to you very soon, it sounds
Yeah,
like.
I'll get it, I'll let people look at it.
Yeah.
Okay.
You get your people, talk to our people, we'll have our people.
We'll have our people meet our people. yeah.
Okay, nice to see you again.
Yes.
All right. Thank you.
You're getting awful tan.
Look at that
around
local
here.
And the real one.
Yeah.
Not just some salad, huh?
Not a rented ham.
I was taking notes the entire time.
Here's how we turn on our hair.
So they went.
You gotta love it, yeah? Oh, that's, yeah.
That was more of a commitment than what I had expected to get out of this. And the fact that he said that he'll put out a joint press release saying that people are still gonna have access to services, it's kind of an important thing to me.
Okay, no, he didn't. He didn't say he would.
Can we get this on YouTube?
Joint release and then just keep on going forward.
July, beginning of July.
Yeah.
But I think the joint
And they've got,
press release, we can do that earlier, right? And then we get together in July.
So we've got 10
Right.
days for them to do something, or else we do this all over again. Why don't we go?
Yeah, why don't we debrief somewhere else?
Yeah, let's go down out back.
Yeah. Oh, we're keeping these signs.
Oh, yeah.
But if I could take like a placard.
We're not going there.
The numbers may change.
Yeah.
You know, let's get, we intimidated them with the signs.
I think that we use this within the context of practice.
No,
And then of course Caitlin wanted to do it in like purple and pink and all the different rainbow colors, and I'm like, no, you can't really do that. All the colors of the rainbow.
you think how we deal with him, because he's a smooth guy. He was able to get us out of there with just about nothing, you know.
Yeah.
We walked in there with a list of 4 demands, and we got one demand that wasn't even on our list. So we got something out of it, but we need to be ready for the next time.
Well,
We're not always gonna do this.
we weren't there with the goal of staying. I mean, next time, if we have to go again, I'm gonna be really pissed. And I will be there for the night.
Practice and a first shot across the water in the beginning of a campaign. This is better than most people get for a beginning.
That's pretty good.
And we need to all be aware that this isn't the end of it, that this is just the very beginning. We're gonna have to keep some pressure
Edit
up.
this tape, we can get it out.